Hello, good evening, and welcome to the Functional Solution podcast and class brought to you by the American Academy of Functional Health. My name is Tal, and I'm joined by my wonderful co-host, Dr. Aisha.
Hey, Dr. Tall, it's nice to chat tonight. I'm excited about our topic.
Yes, absolutely. And if you're looking for learning more, expanding your knowledge and clinical skills with the root cause approach to chronic diseases and gain additional protocols, integrated medicine protocols for your patients to help them thrive and improve their health, you are in the right place at the right time. And so every week we join together to talk about the most actionable science-based strategies to really move functional and integrated medicine forward and really help you to offer comprehensive care to your community. And today I'm very excited to talk about this topic. I know, Dr. Esha, that you're very passionate about this topic as well. And this is really looking at the connection between environmental chemicals and weight gain.
Yep. Yeah, this is a really exciting topic. I think especially because it's so often missed and it's something that's in our patients' faces every single day, right? From the moment we wake up and we're surrounded by compounds we're putting on our body, on our skin. So it's really a great topic to peruse, and I'm excited to detail some of these today.
Absolutely. And this is such a big topic. I mean, there's probably two major reasons why we picked this topic. One, there's a lot of patients out there who are struggling with chronic metabolic conditions and weight gain, right? I think the statistics were showing us that about 1 out of 3 people, adults in the United States, are struggling with overweight, and then more than 2 in 5 adults are considered obese, right?
Yeah.
So it's a big challenge, especially where we know the impact of overweight or obesity on pretty much almost every other system in our body, has a significant negative impact. So even if you're not you're a practitioner, a nurse practitioner, physician, pharmacist, or a PA, or any other practitioner, right? And you chose not to focus on weight loss strategies for your patients, it's really important to understand it, because pretty much almost every condition that you're seeing in your practice, from cardiovascular to endocrine to joint related conditions, they're all going to be impacted by your patient's body weight. So one, it's very common in the United States for patients to struggle with excess weight. And two, it will negatively impact pretty much every condition almost every condition they're coming to see you with. So, and then the third reason why we chose this topic of environmental factors and weight gain, it's because it's so many times it's missed. It's just not talked about. It's just not taught in the medical and nursing programs. And providers who do not understand this topic are missing a big part of the puzzle, which we're going to talk more about today, about the top 3 mechanisms in how physiological mechanisms, how these exposures that we're all exposed to these factors can actually increase the risk of weight gain and obesity. So we got a lot to discuss today. We got some cool studies. We love using images from peer-reviewed published studies. So we're going to show you some really cool data to better understand how our exposure through ingesting those chemicals, or through skin contact through, for example, cosmetic products that so many patients use, can significantly increase the risk of weight gain. And we're also going to talk about some practical strategies, like we always like to do, to help you to already from tomorrow, to help you to provide better guidance for your patients. So in the functional approach, right? It's interesting because there's in the standard of care, and we see this from so many practitioners, both physicians, nurses, nurse practitioners, who are actively working in weight loss clinics, right? And there's more and more weight loss clinics popping up because, again, 1 out of 3 Americans are struggling with persistent weight gain. And so many of those practitioners come to our programs because they understand that with this so-called very simplified approach of, the counting calories or trying to exercise or even prescription of weight loss medication, it has limitations, right? And while those are important and could be very beneficial for patients, if we ignore the root causes of weight gain, metabolic dysfunction, and obesity, in the long term, the patient could develop other problems. Or, as we know, for example, with some weight loss medication, there could be a rebound. Same thing with diet, right? Patients diet, they count calories. That has a significant long-term impact, but sometimes negative. And then there's a rebound, right? Sometimes they get that weight with interest, right? So that's why it's so important for us to be able to identify. So even if you're just prescribing weight loss medication or you're referring your patients out to a dietitian, it's really important to identify those environmental factors, understand them, and be able to explain that to your patients. So as a functional medicine practitioner, you understand the different factors such as nutritional insufficiencies, which we have a special class coming out on overfed, undernourished concept. And then we got, of course, the gut health is a big topic that we previously talked about, chronic inflammation, and environmental triggers, which we are going to talk about today. And really understanding and addressing those root causes with your patients can help you to move beyond symptomatic management towards really restoration of metabolic health and improved patient outcome. So this is why we're here, right? We're here to learn more about how we can help our patients and how we can provide a service and recommendations that gives them a long-term results, right?
Yeah.
Just now, right? So let's take a look at a quick picture. This is from the CDC, just to get an understanding of the nature of the problem we're dealing with right now. And you can see here, this is the current estimated prevalence of weight gain, and obesity. So you can see that there are multiple states there's patients on average that are struggling with significant increase in weight. And of course, diet, lifestyle plays a role with it, but we want to look at correlate this data with really interesting another picture that shows us the environmental triggers and weight gain, right? So this is really interesting. And if you look at this image, you can see the total pounds of toxic chemicals that are released into the environment per state. And for example, Alaska in the previous picture was considered to have high rates of weight gain. And you can see that Alaska here is colored black because it produced the most amount of toxins, right? Same thing with the East Coast. Many of the states in the East Coast, you can see that in the previous picture. Jacob, can you put up the previous picture for a second? You can see the previous picture. There's a lot of red spots, right? A lot of states that are considered high amounts of high struggle with weight gain and obesity. And you can see if we go back to the toxicity, you can see that those states have higher release of toxins, right? They're considered to be darker on the map in the East Coast, right? So this is where we start asking ourselves, what is this correlation that we're seeing between the amount of toxic factors or chemicals, that there's thousands of different chemicals, and how does it impact our physiology, causes weight gain and obesity. And today, with together with Dr. Esha, we're going to discuss that. We're going to discuss physiologically what's happening there, right? What's happening there, and what are some of the strategies we can utilize to help our patients, right?
Yeah. So, I think it's interesting because the current model, I think a lot of patients are led to believe calories in, calories out, right? And people often say, well, I'm doing all that, I'm still not losing weight, or what else could be going on? And it's so often not the conversation around environmental pictures, right? So I'm really excited that we're talking about this. When you think about weight gain, it's a really complex, challenging issue for a lot of people. And like I said, there's an oversimplification of calories in, calories out. That's not always the case. The reality is that weight gain is highly influenced by multiple factors beyond just our diet. And as a functional medicine practitioner, understanding your patients' like root causes of weight gain is really going to kind of help empower them to understand what's happening: gut imbalances, hormone and neurotransmitter issues, exposure and accumulation of environmental factors, which we're talking about today. We also have to think about the reality that many patients live. Ultra processed foods, calorie dense foods are cheap, readily available. Chronic stress is at an all-time high. Many people actually lack access to adequate education and adequate resources that actually explain how all these factors work together and disrupt a healthy metabolism. On top of that, you add in the healthcare system, right? Patients are often left with few options beyond prescription medications, some dietary recommendations, referrals for bariatric procedures. And then meanwhile, the market is flooded with trendy, unsustainable diets that offer these really quick fixes, but they're not really sustainable long term. And so your patient ends up back in the same spot. So this is why we have this like pill for every ill model, and people continue to struggle, continue to get sick, and suffer with those chronic metabolic complications of excessive weight and excessive weight gain. So, what's often missing from the conversation is education around environmental lifestyle triggers that exist in our immediate surroundings. So factors that can quietly but powerfully impact long-term health. So let's take a look at this really cool image from a 2024 Journal of Current Nutrition Reports. If you look to the left, the orange, you'll see the risk factors for weight gain, obesity, and as you can see, they're multifactorial. So you have genetics and heredity, but that's not really the main culprit when you look at kind of some of the literature around metabolic issues. More so the unhealthy dietary patterns. Yes, we know that. Lack of physical activity, more increased sedentary lifestyle. Environmental factors, socioeconomic status, stress is a huge one, emotional stress, other medical health conditions, smoking and insufficient sleep. I would also add to the list gut microbiome issues as well, HPA axis issues as well. But there are many risk factors for metabolic disorders. And then we're going to talk about the complications a little later, but just these are some of the general health complications of having excessive weight gain, right? So blood sugar abnormalities, diabetes, cardiovascular disease, increased risk of certain cancers, blood pressure, stroke, the metabolic syndrome, sleep apnea, right? So mental scenarios, mental disorder, depression, anxiety, and so forth. So there are many different consequences that come with having excess body weight, adipose tissue, because it basically creates its own kind of hormone soup that can then influence the body. So with that being said, let's jump into a pop quiz and kind of test our knowledge. So first quiz: which of the following statements best reflect the modern understanding of weight gain according to recent research? So A, weight gain is mainly caused by consuming more calories than are burned and can be solved through diet and exercise alone. B, weight gain is a simple issue of personal responsibility and food choices. C, weight gain is a complex issue influenced by factors such as environment, stress, hormone dysregulation, and a lack of adequate education or healthcare support. And D, weight gain is mostly genetic and cannot be significantly influenced by lifestyle or environment. So go ahead and pick your answer. All right, so the correct answer is going to be C, of course, multifactorial, very complex, not just genetic, not just diet, not just lack of exercise. So that's just kind of a baseline of the main culprits for influencing weight gain. And we're going to talk next more so about why you want to, educate your patients on metabolic health and environmental factors related to weight, because these are the complications that can occur as a result of excessive weight gain and excessive adipose tissue.
Yes, absolutely. And it's interesting that you mentioned the different strategies that are available to patients. It's interesting when I first started working with patients, that was like probably over about 25, 26 years ago. And I really loved fitness as well. So I was working in the clinic, essentially in the mornings, and then in the afternoon or evening, sometimes I would go and do work with clients doing personal training in the gym, one-on-one. And I really enjoy that. But seeing the same person once or twice a week and helping them improve their cardiovascular function, a lot of clients would come in for losing weight, obviously.
Mm-hmm.
But what I noticed was this interesting struggle that many of them would try different diets, and they would really do the aerobics and anaerobics workout and really work out hard. And then there was always that question, like, why do some patients starting to lose weight, look fitter, faster, and some people continue to struggle no matter what they do, right? And of course, I've followed up with many of my clients who decided to do for example, the bariatric surgery and tried different things. What was interesting is that, of course, today we have more information coming up on some of these. For example, we know with GLP-1 agonist medication are becoming very common, right? You can almost get it now from logging into apps.
Exactly.
I'm seeing ads right now all you got to do, you don't even have to see a provider. You can get it online, this virtual thing, right? It becomes almost like candy in the gas station, right? Easy to get. And while those medications could be beneficial, there's also practitioners that we've talked to that say, there's higher risk of thyroid carcinoma, there's higher risk of sarcopenia, there's higher risk of losing bone mass, right? There's also the unknown of the long-term effect, right? Because these are essentially medication designed for glucose dysregulation, right? So we don't know, and what's going to happen to the patient when they get off it, right?
No, that's a really good question. I've talked to a lot of patients who have or want to try the medications or have tried them, and they notice issues like, for example, with simple like hair loss, right? Because there's a general reduction in nutrition getting in just as an effect of the medication. So your body has to now reprioritize where to send the nutrition that it is getting, right? So other areas you see start suffering, hair health, hair quality, things of that nature. So even in smaller areas, you're starting to see those shifts with those medications. So I do think that, topics like these are really important because those issues are still there, right? You're still exposed to these environmental factors. So then where does that lead?
Exactly. Because one, we're not resolving the root cause.
Exactly.
And we're completely relying on, on external drug that is supposed to stimulate or provide to our body something that our body naturally is supposed to produce, right? It's a peptide that our body is supposed to produce naturally. And so, and a lot of nurse practitioners and physicians who come into our programs, they ask us, should we look for just natural alternatives, and somewhere in the middle, through having those discussions, we understand the value of it, sort of in the short term. But there's, interestingly, we just recently had a discussion in the functional weight loss certification program, which is a highly recommended. It's like a 2 months program, and you focus on the root causes of weight gain. We had a discussion about what if we do microdosing of GLP-1 or use natural alternatives. So we actually teach what are the natural alternatives to increase your GLP-1 production in your body in a natural way. There's some herbal compounds, there's some dietary strategies that are found in research to be useful. And of course, we're not going to get into it because it's a whole big different topic by itself. But it's important for us to know that while, those strategies could be beneficial, they also have side effects. So, I have had a client comes up to mind, and she came in, she was overweight, kind of sort of almost obese, and she was struggling with weight gain, and she came in for arthritis. Right? She had arthritis, she had osteoarthritis in her knees, she had some significant arthritic presentation, swelling of the joints, pain. And it was really interesting because she asked me about losing weight, and I said, of course, that's going to be beneficial. And back at the time, we didn't really focus or offer programs for weight loss. But what really made me change my mind about this concept of the importance of weight loss was, as she asked me about bariatric surgery, what do I think about it? And I said, listen, I think it could be beneficial, but we also have to look at the side effects, which is, some reports on nutritional deficiencies, right? You can alter your microbiome, gut microbiome bacteria. That's a real concern, developing small intestinal bacterial overgrowth, or even what does the rapid gastric emptying will do to your blood glucose levels, right? Like, it can, just by reducing the absorption of certain important nutrients such as B12, you can struggle with other symptoms, right?
Yeah, that's true.
So what we kind of decided to do at that point is, she was saying, okay, you know what do you think I should do? And I was like, listen, let's focus on the root causes of your inflammation, the osteoarthritis. Let's focus on those root causes. Focus in the next 3 to 5 months on really optimizing your health, and then let's see where that takes us, right? And this is the interesting part. We slowly switched her to more of the principle of the anti-inflammatory diet, and really small changes, nothing major. She didn't exercise still because she was still in pain. And for the next 5 months, we saw her losing over 25 pounds.
Wow.
Just by focusing on the root cause. So as her inflammation reduced, she also lost weight.
That's impressive.
Right? Yeah, it was really impressive. And I didn't even know that until we kind of measured it. We did like we saw her every 2 weeks, but then 3 to 4 months into it, we did like a more comprehensive. We took her weight again and did the whole thing. We were like, wow, it's like 25 pounds of weight loss. So that really changed my mind about, if patients are looking for it, we should understand it, at least these physiological changes, and then understand the root cause, because then you can improve their health overall, not just for what they're coming for, or if they're coming for weight gain, you can offer them functional medicine and also help them address other things, right? So that's a really interesting part of.
Thanks for sharing that case. That's really impressive.
Yeah, it was fascinating. I always say I try to learn. We try to learn from our patients as much as they learn from us, right?
Yeah.
And so this is where, when we kind of shift into understanding how does obesity impact other conditions, there's a really cool picture that I wanted to share with you guys. This is from 2018. This is from a publication in 2018, and it's very simple. You can see here the obesity in the center, and it really impacts every aspect of our body, as I mentioned, from type 2 diabetes to mood disorders, even increasing cancer risk. There's cardiovascular, that's very obvious. even reproductive disorders, right? So if you see patients and they struggle with fertility, it's really interesting that fertility is they don't talk about the metabolic function. They don't look at how they can help those patients to reduce their body weight, right? Liver diseases, hypertensions. This is again why we're saying every physician, every healthcare practitioner would benefit from understanding the root causes of metabolic dysfunction and obesity, because then we can help our patients in a much more comprehensive long-term impact. Now let's take a look at another picture. This is a really interesting picture to kind of explain what's the connection between weight gain and, of course, cardiovascular diseases or other conditions, right? And in the middle, really the concepts that we want to focus on is to remember that concept number one is that adipose tissue is a metabolically active organ, right? It's an immune organ, and it's an endocrinology organ. It's an organ that secretes hormones, secretes inflammatory cytokines. It can contribute to inflammation. It can contribute to an increase of reactive oxygen species, ROS, and oxidative stress, which causes damage to our cells and organs. It could, through the impact on adiponectin and leptin, it could change our brain chemistry. It can impact our satiety. It could, and hunger. It can impact also our insulin sensitivity and contribute to insulin resistance. And so by doing all of those, right, it could directly and indirectly contribute to cardiovascular diseases and as well impact our brain, right? Because if you got systemic inflammation, it could also contribute to neuroinflammation, which over long term can contribute to depression, anxiety, right? Emotional eating disorders, right? So that's one of the biggest challenges. And of course, obesity directly can increase the risk of obstructive sleep apnea, right? Which is by itself, could significantly increase the risk of mortality and cardiovascular diseases. So again, we're starting to dive deeper into these and understanding that obesity and weight gain are really, really critical for pretty much every primary care to understand and to provide guidance to their patients, right? So let's take a look at the pop quiz. What is the relationship between obesity and chronic diseases? Option A, obesity does not impact the risk of most cancers. Option B, obesity increases the risk of cancer by increasing inflammation. Option C, obesity increases the risk of chronic diseases by contributing to insulin resistance and increasing reactive oxygen species. And then which of these answers is true about the relationship between obesity and chronic disease? I'll give you a few seconds. And the answer is B and C. So obesity increases the risk of cancer by increasing inflammation, and obesity increases the risk of chronic diseases by contributing to insulin resistance and increasing reactive oxygen species. So this is where we're looking at, this is where we're starting to dive into how does environmental chemicals play a role in this. Now that we understand the connection between the excess body weight and chronic conditions, now we want to talk more about, well, how does environmental chemicals that we're all exposed to are connected to that, right? And Dr. Esha, this is a really big topic, and we're going to try and summarize it into like 3 factors,
Yeah,
right?
it's so hard.
We're gonna try to into just 3 factors. I mean, we have 2 modules that are just specifically on detox pathways and stimulating detox pathway and testing and environmental chemicals. But let's summarize it so we
Okay.
can get some actionable points. And of course, starting with, what environmental chemicals are we talking about?
Okay. I'm really excited that I get to present on this section. I really love these things. Okay, so environmental chemicals, what are they? They're all around us. I tell everybody there's not a single person alive that has a non-toxic, if you will, body. Like we all have some level of environmental toxins. If you're a living organism, you have something. The goal is to have a really small amount or have really great detox pathways so they're not significantly impacting the system. So environmental triggers, the air we breathe, right? The water can be the water we drink, can be containers we drink out of, can be the foods we're consuming, the products we put on our skin, and so forth. So they're pretty much everywhere. These environmental chemicals are called endocrine disruptors. In this context, they're also called obesogens. If you want to peruse the literature, you can just search for obesogens and they'll come up as these types of compounds and specifically how they impact weight. They impact inflammatory signaling. They disrupt insulin regulation, contributing to insulin resistance. So we're going to pop a really cool image on the screen so we can kind of look at specific triggers. So in the middle, you see endocrine disruptors with obesogenic properties. So the very top, you have the bisphenols, right? So these are the BPAs you hear often spoken about, and I'm going to deep dive into that in a little bit. But this will be like packaging, right? So plastic bags, water bottle, canned foods, dental materials, other plastics. If you're leaving water bottles out in the sun, that's really not a good idea. The heating element of that can really make things worse. You have phthalates, right? Which are more so cosmetics, perfumes, lotions, food packaging, toys, adhesives, sealants, medical devices, and so forth. So you see a lot of like phthalate-free shampoos, conditioners nowadays, or kind of more health-conscious products we're putting on our skin. Those are kind of the better choices to choose from. You see the PFAs, which are perfluoroalkyl substances. I can never say that one, but these are like the non-stick cookware, your water repellent clothing, right? So you think about like moisture wicking clothing and things of that nature, stain resistant fabrics. All of these things have chemicals sprayed on them to give them these properties, and those things eventually can rub across the skin, be absorbed into the body, and influence our endocrine systems. You have your PCBs, your polychlorinated biphenyls. These are coolants, lubricants, and transformers. They're also found in butter, interestingly enough. You have your organotins and paints and stabilizers, plastics. So if you know people or patients that are working in these specific industries, they have a really high burden of these. And then all the rest of us who don't work in these specific industries, industrial kind of scenarios, we also have a high body burden. You have your dioxins, right? So those are environmental pollutants, byproducts of burning trash and waste. You have your polybromated diphenyl ethers, which are kind of flame retardants. So think about when people have new furniture, new carpets, right? A lot of these things have flame retardants sprayed on them, and those things off gas, right? And they eventually get into the system. You can breathe them in. And then the last thing are the parabens. And so those are like preservatives, personal care, pharmaceutical products. So there's not a single person that I know of that is able to escape all of these things. It's just a matter of reducing your burden because they're pretty much everywhere and so ubiquitous nowadays. So you can live a really low tox, healthy lifestyle, but I would definitely say the goal is improving detoxification systems and reducing your exposure as much as possible. So that's the first image. And now let's kind of chat about BPA. So bisphenol A, like I said, found in plastic, epoxy resins, many consumer products such as toys. So think about little kids chewing on toys and early exposures to these kind of obesogenic compounds, food and beverage containers, water supply pipes, metal tubing, and so forth. So dermal exposure can occur through dental materials, medical devices, skin contact with thermal paper, personal care products, receipts like touching a receipt at the grocery store, right? Those types of things can also give you a high exposure to this. When you look at some of the information with the United States EPA, Environmental Protection Agency. They reported that 400,000 kilograms of BPA are released into the environment every year. So BPA, man-made environmental chemical, and the group of chemicals referred to as estrogenic endocrine disrupting chemicals, right? They have an estrogen mimicking response, and they disrupt estrogen systems in the body. It has adverse effects on health, and it's suspected to impair reproductive and adipocyte, your fat cells, adipocyte function. So if you look at this, there's a meta-analysis, and we're going to show an image from a different study, but really quick, a meta-analysis included studies with 888 to 4,700 participants, 6 to 74 years old, and reported a positive correlation between the level of BPA exposure and obesity risk. And then there was an interesting dose response analysis that revealed every 1 nanogram per milliliter increase in BPA increased the risk of obesity by 11%. 11%, right? So that's pretty intense, especially when you look at children and their early exposure, and then the bioaccumulation of these things over our lifetime, and just the increased metabolic risk with pediatric populations too, which is a whole other topic. So last image I want to show is from a 2023 publication in the International Journal of Molecular Science. You see like specific routes of exposure for BPA, right? So skin contact, oral intake, inhalation, breathing these things in, and then even fetal exposure. So as you just look at the chart, we're not going to go through all the little nuanced pieces here, but you'll see kind of how the exposure to BPA and phthalates as well supports this adipogenesis effect, right? So kind of impacting your fat cells, like Dr. Tall said, your adipose tissue is an organ in and of itself. So these chemicals actually can impact that. Epigenetic regulation, so impact your gene expression, impact your neuroendocrine signaling, right? So impacting your appetite and satiety functions, can be very pro-inflammatory, promote pro-inflammatory pathways, lead to increased metabolic inflammation. You see increased cytokines, interleukin-6, TNF-alpha, and so forth, can impact your gut microbiome and lead to gut dysbiosis, which can then fuel even more inflammatory cycling, and then also create a dysfunction in your thermogenic adipocytes, which are kind of considered more of the positive adipocytes, if you will, view it that way. But this is just one compound. This is just BPA and how it impacts the system. Think about all the other ones we discussed and how those also have their own metabolic, insulin dysregulating impacts as well. So that's kind of the BPA section and a breakdown of what these chemicals actually are, but they're all around us. So let's do another pop quiz to test our knowledge of BPA. So where is BPA most commonly found? A, only in food preservatives. B, in plastics, epoxy resins, consumer products like toys and containers. C, natural food sources like fruits and vegetables. And then D, herbal supplements. Give you a few seconds. Correct answer is going to be B, plastics, epoxy resins, and consumer products like toys and containers. Next we're going to discuss actually different mechanisms of actions for these obesogens. But, if you're interested in learning more about this functional and integrative treatment of weight gain and metabolic issues, log into your advanced and clinical functional medicine platform. You may also consider checking out the functional weight loss program that Dr. Tall mentioned, and you can also book a coaching call with us. So there are a few options to learn more and gain more insight here. So you can book a coaching call to review case studies if you have some challenging cases, and we can kind of get you set up right away with some functional medicine next steps. And it's a part of our program. It doesn't cost you any extra. So if you need that, please reach out. And I'm going to pass it to you, Dr. Tall, to kind of do another deep dive on some other things here.
Yeah, thanks so much for talking about that, Dr. Esha. I know that it's a lot of information, and we always try to present it in the most visual way, right, when we teach those concepts. And of course, when you log into the Advanced and Clinical Functional Medicine platform, it's not just to get certified, but it's also to really expand your knowledge, because we have classes that are specific, and they kind of open up these topics more in terms of not just the mechanisms, but very importantly, like what's the signs and symptoms of exposure to this group, or endocrine disruptors, or heavy metals, or like really understand and start to identify the patterns. And then from there, what are some of the advanced or specialty lab testings that patients can order for themselves, or you can order them for your patients. And it's really helpful to identify if a patient has some of those accumulation of those environmental factors. It's really important because sometimes, those patients could be struggling for years. And again, looking also at the supporting their detox pathways, which we're going to talk a little bit about in the next few minutes. But again, it's looking at the whole picture, looking at optimizing health and wellness. And so now that we understand more about BPA, what it's doing to our body, right? Let's go into more to talk about the mechanisms, right? So the mechanisms is really, really interesting. There are, if you just take three factors, three things from our conversation today, is that, and we're going to mostly focus on BPA, right? There's different groups we go into more in the advanced program, but if you just focus on BPA, remember three things: insulin resistance, inflammation, chronic systemic inflammation, and endocrine disruption. That's really the three things you want to remember. And we know that there are different ways, different pathways that are impacted by environmental triggers. But of course, upregulating the inflammatory cytokines contribute to low-grade systemic inflammation, right? And then oxidative stress, right? And then there's a lot of other pathways that are responding to that, right? There's an increase in cortisol, which impacts our HPA axis. There's an increase in low-grade inflammation, which is commonly seen in metabolic diseases, right? That's linked to insulin resistance, right? And then insulin resistance leads to increase in glucose levels in our blood, and that's also connected to obesity, right? So I'm trying to show you how it's all connected. It's kind of like a vicious cycle. Everything feeds each other, right? And of course, we like to look at pictures to really understand things in a better way. So let's take a look at the modeling of the mechanistic effect of obesogens, which obesogens essentially are environmental factors that contribute to obesity. And this is from a published study in the International Journal of Obesity. It was published just recently, 2024. And this really explains in simple terms how environmental compounds are considered, why they're considered to be endocrine disruptors. And there's actually a group in the environmental chemicals that are considered endocrine disruptors. And those are essentially, they're called endocrine disruptors because they alter the multiple pathways in the hormone system. So, for example, we can see how environmental chemicals alter insulin sensitivity on an organ level. We can see how they lead to an increase in the number of adipocyte cells. They can increase the size of adipocyte cells. They can alter the hypothalamic regulation of appetite and satiety. And they also alter our basal metabolic rate. So there's different factors can all contribute to weight gain. Now, there's another concept that we're not going to get into in our today's conversation, which is inflammaging. And there are other reports that some of these endocrine disruptors can actually contribute to inflammaging, which is essentially dysfunction of the cells and associated receptors. And that could lead to accelerated aging, symptoms and signs of accelerated aging. And so if you got a patient that they're starting to gain weight, they're starting to feel fatigue, they don't understand what's going on, or they have signs of inflammation, sometimes it could be due to cellular dysfunction, a condition that is called inflammaging, right? By the way, there's specific lab testing that can give us indication for that, and there are specific treatment protocols for that. We're not going to get into it now because we have a whole, it's like it will take us probably about 3 to 5 hours to cover that topic, but it is very interesting and highly recommended. You can log into the advanced functional medicine platform, and there's a specific module on inflammaging and treatment strategies and how it's related to metabolic, women's and men's health conditions. So you can log into that and continue your learning. Now, let's take a look at another interesting picture that kind of summarizes what we've talked about with the obesogen mechanism of action. And you can see on the top is increasing the adipocyte number, increasing adipocyte size, altering endocrine regulation, changing the hypothalamic regulation of appetite, and altering the basal metabolic rate and energy homeostasis in the mitochondria. You can see that on the left side, right? And that's essentially a part of the inflammaging concept that I was talking about. And then you also have reducing the response to insulin on an organ level. And this is from a publication in 2021. And it's good to understand. It's important to understand the mechanisms, so then you can start identifying which one of those, how is my patient impacted by these environmental factors. If they, for example, they drink from a bottle of water, right? They eat food that was stored in plastic containers or heat up in a microwave with plastic container. If they are, you can also get exposed to some of these endocrine disruptors. They're found in plastics. So think about the dashboard of your car, right? Just sitting there in a sunny day, hot day, right? Those chemicals are breaking down into our environment. And then we sit in the closed cell while we're driving for 30 minutes or an hour or 2 hours every day, and we're just breathing those chemicals in, right? So we're all exposed to that, right? And it's just a matter of how much our body is efficient in eliminating them out, right? Via detox pathways. And also, how much do we consume those through food and water? How much do we expose to them through lotions on our skin, right? So there's all these different factors we have to consider, but we always try to simplify it into mechanism, signs and symptoms, and then what is the clinical application. So let's take a look at a pop quiz, and we're going to look at obesogen's contribution to endocrine imbalance by doing all of the following except for one. So which one of those do not contribute to endocrine imbalances? Obesogens are in a way that they contribute to endocrine imbalance. So option A, increasing insulin sensitivity. Option B, increasing number of adipocytes cells. Option C, altering hypothalamic regulation of appetite and satiety. Option D, changing basal metabolic rate. So which one of these is the correct answer? It's one answer. Which one of them is the correct answer for obesogens? Which one of them is not contributing, does not describe how obesogens contribute to endocrine imbalance? I'll give you a few seconds. And the correct answer is A. Obesogens do not contribute to endocrine imbalance by increasing insulin sensitivity. So hopefully by now, as we're sealing this section, you now understand these concepts and the three important mechanisms that we've talked about. So now we are going to talk about how to support the different ways you want to help your patient to support their weight loss through, again, focusing on the root cause, right? So let's divide it into two parts. The first part is reducing their exposure, right? And this could be done in a simple, just a few minutes, questions and educating your patients. We've had physicians who go through our programs, nurse practitioners, PAs, lots of primary care providers. And then we also have registered nurses, pharmacists, right? We have a variety of professionals who are, or health educators who are offering private consultations to patients. And while they don't diagnose or treat diseases, they don't do primary care, they focus on really and educating their clients about what it is that they need to do, in the same way that you're sitting here and you're learning about what are the clinical application or strategies that they can use. So one, we always want to reduce the exposure, right? Are your patients using personal care products? Are they using foods or drinks that have increased endocrine disrupting chemicals? Are they what environment do they live in? What environment do they work in, right? For example, individuals who use the ready meals that are sitting in plastic, right? They have increased risk. Individuals that maybe they're not detoxifying properly, right? Maybe they don't have enough bowel movements. That's another risk factor, right? That's an obviously sign that they're probably not eliminating properly, right? So when we talk about reducing exposure, of course, there's multiple factors that we have to consider. Today, I'm just giving you a few examples, but I'm going to show you 2 quick and simple recommendations you can offer your patients to reduce exposure, right? So the first one is a phone app that is called Think Dirty, and we'll show a picture of that. This is, by the way, free to patients. It's free to all patients to use. They can go to the app store on their phone and look for Think Dirty. So Think Dirty, it's a mobile app, an online platform that helps consumer to learn more about the potential toxic and harmful ingredients. They can actually scan or look for a product. You can see in the picture here, I brought you a picture to show you how they can scan a product, and then it'll give them score of like from safe, which is green, to high score, which is red and dangerous, or could increase the risk of certain conditions. And it will actually tell them which harmful ingredients they might have in their personal care or beauty products. And it's simple to just scan each product using this phone app, and it helps consumers to avoid harmful chemicals. The second app that your patients can use is called the EWG Healthy Living. And we'll show a picture of that. That is an app that was developed by the Environmental Working Group. And essentially, this product is focused on, it contains a very large database. So it contains food items, it contains personal care products, it contains cleaning products, gardening products. So it's more broader in terms of the amount of products that it's containing, but it is really helpful to scan or put in the name of the product and see, is the shampoo or cream you're using containing environmental chemicals? Is your cleaning products contain environmental chemicals? So it's free to use, and we like recommending it because it's simple to use. You don't have to be tech savvy or anything like that, and you can download those and start cleaning out your environment, right? Now, the second thing, there's other strategies. If you want to learn more strategies, obviously log into the Advanced and Clinical Functional Medicine platform. Now, there also now the second step is to help them to detoxify, right? So we want to make sure, one, they have daily bowel movements. Two is, one is good, 2 or 3 is even better. We want them to make sure that they stay hydrated. They consume fiber. There are some really interesting clinical studies about fiber. We're not going to get into which fiber works best for heavy metals or others. but I'm going to give you a general recommendation is just to eat more fiber, right? And then if you're looking for a supplement, then really our goal is to stimulate both the liver and gastrointestinal detoxification pathways. And so the product liver GI detox is a really good product to consider. This is by Pure Encapsulation, which is a professional grade supplement company. And this product supports phase 2 detoxification enzymes, supports the intestinal integrity and proper nutrient utilization. And it contains very specific antioxidants, amino acids, and botanicals to support, to optimize detox process, right? Now, of course, as you advance your skills as a practitioner and you dive more into the integrative and functional medicine classes, you're going to learn very specifically, how do I identify if my patient's phase 1, phase 2, phase 3, which lab testing I can order, and then what are the specific botanicals and nutrients and amino acids that can stimulate each one of those phases. So that's what we call, as you advance your skills, you can transition from like general protocols to more precision medicine, which really benefit your patients in a much, much more personalized way. And this is really how you get better clinical results, faster clinical results, develop better reputation as a health expert, and also, develop your personal practice, right? You grow your practice by having better clinical results. That's always the best form of marketing, right? So you can check out the liver GI detox. Now, if you're interested in advancing your skills, there's two great ways you can do that. One is if you just want to focus on weight loss, metabolic dysfunction, hormonal imbalance, we have a really amazing program. It's a 2-month program. It started in August. It's called the Functional Weight Loss Consultant Certification. We do offer $2,000 in the next 2 weeks until the end of the month, and which makes it only $950 instead of $2,950. It's just $950. This scholarships, by the way, is offered to healthcare practitioners. So all you got to do is go to the website, put in an application, and we'll post a link here so you can put an application. It's pretty simple to apply for the scholarship, and if you get it approved, then you save $2,000. And it's quite an amazing program because it includes both live classes like we do today, but a little bit more in detail, right? So we get together as a group, physicians, nurse practitioners, nurses. We get together and then we dive every week. We focus on one root cause. And you also have on-demand classes on more specifically the lab testings and all that stuff. So it's a really cool program, highly recommended. And then if you want to get certified as a functional medicine practitioner, we have an amazing program that includes the functional weight loss program with it as a gift. And it includes 10 different specialties. So you go beyond just weight gain, understanding weight gain. We also teach you about the functional and integrative medicine for women's health, men's health, cardiovascular condition, endocrine conditions, autoimmune conditions, genomic testings, all the advanced specialty lab testings are covered. It's self-paced, 100% online. You also have a mentor like Dr. Esha and Dr. Chill and myself with coaching classes. And you also get something that is quite incredible, which is the practice building classes. And currently, you're also getting the phone app. So the phone app, the newest version, is coming out very soon with all the treatment protocols. So that's all going to be available to you when you join the functional medicine community. So as usual, this is a very, very exciting time to offer comprehensive care to your patients, and patients are looking for it. And so we can teach you how to fill up your schedule. We can teach you how to get patients that you really gonna enjoy working with. We're gonna teach you also offer cash services, so you don't have to negotiate with insurance. You get paid whatever you deserve to get paid for your skills and wonderful outcome that you get for your patients. And as usual, I really want to thank all our teams of presenters who have worked really hard to create those presentations. I want to thank Dr. Esha for being here and sharing her years of clinical experience. I also want to thank our media team and Jacob for making it possible for us to be with you wherever you are. And it's always fascinating. It's always really a big joy for me to talk to practitioners from the US, from Canada, from South America, from Asia, we have a few practitioners also from Europe. So it always gives me so much joy to hear practitioners learning, applying, getting better clinical results, and also growing their practices. So I really appreciate each one of you for taking the time and investing in your skills and really bringing hope to your patients, because we know there's so many patients struggle out there, and they're just not going to get any of this root cause approach or natural solutions to their conditions. They're just not going to get any of this knowledge from anywhere else. So you are really going to be a few of the practitioners that will guide them towards better health. So I have much appreciation for you for doing that for your community. So this is all we have for today. And let's keep on learning. Let's keep on developing our clinical skills and also help you grow your practice. So if you got any more questions, reach out to us. By the way, we also have $2,000 scholarship you can apply towards the Advanced in Clinical Functional Medicine program this month. Reach out to us for more information. Our admission advisors will be happy to get you more details about this program. So thank you so much for being here. We will see you in our next trainings. And by the way, on July 26th, we have a special training. It's one day on Saturday, and we're going to dive deeper into the 5 root causes in functional medicine. We're also going to give you the evaluation tool, the functional medicine evaluation tool that the Academy has developed over the last 7 years. And that will help you to identify much more clearly and fast, identify what are the 1, 2, or 3 factors you want to focus on with your patients. I've used it in my practice for years. It's been incredible, and saved me an hour and a half in evaluation with each patient. So if you want to get all these clinical tools, join the Clinical Functional Medicine Summit. Just one day. It's about 8 or 9 hours, and we're going to cover all of these different factors, root causes, and of course, have amazing presentations from experienced clinicians. So join us on the 26th. All you got to do is just log into your functional medicine platform, and you get a ticket as a gift from us. So log into your Advanced Functional Medicine platform. On the top, you're going to see Get Your Ticket. This is a $2,400 ticket you're going to get from us. Just click on it and save your seat for this coming class. So it's not this Saturday. It's the next Saturday, Saturday next week on the 26th. I look forward to see all of you there. We're going to talk about root causes, clinical guides. You're going to get a clinical guides with all the treatment protocols from us. And we're going to talk about the business of functional medicine and how to make this profitable, how much you should charge and all that stuff. So I look forward to see all of you there. And if you want more information about our programs, reach out to us. In the meantime, take care of yourself. Have a wonderful evening, and we'll see you in the next class.